One of the biggest mistakes practices make is assuming the patient experience happens automatically. Patient calls the office, they schedule an appointment, they come in for a consultation. But the reality is that every step of the patient experience influences whether the patient trusts you, accepts the treatment, or refers others. The most successful practices don't leave the patient experience to chance. They design it intentionally. This is what would be called mapping the client journey. What is the client journey? The client journey is the complete experience a patient has with your practice, from the first awareness of your clinic to their final follow-up. This journey includes multiple stages. Each stage influences how the patient feels about your practice and where they decide to move forward with treatment. When the journey is designed thoughtfully, patients feel confident, informed, comfortable, and supported. When this journey is poorly designed, patients may feel confused, rushed, uncertain, and hesitant. These emotions directly impact treatment acceptance and referrals. The 5 stages of the client journey. A well-designed patient journey typically includes 5 stages. The first stage, stage 1, is awareness. This is when the patient first becomes aware of the practice. They may find you through Google search, social media, advertising, physician referrals, community events. At this stage, the patient is usually asking themselves, can this doctor help me with my problem? Your website, your reviews, and educational content should clearly answer that question. Stage 2, first contact. The first contact with your office through a phone call, a website form, or an online booking system. This moment is extremely important. The patient is evaluating how friendly your team is, how quickly they respond, and how easy it is to schedule. A warm professional first interaction immediately builds confidence. A rushed, disorganized experience can create hesitation. Stage 3 is the consultation. The consultation is one of the most important moments in the entire journey. The patients are trying to determine, do I trust the doctor? Do I understand my condition? Do I believe this treatment will help me? Successful consultations focus on education and clarity, not pressure. Patients who understand their condition and treatment often feel far more comfortable moving forward. Stage 4, treatment experience. During treatment, patients evaluate your practice through comfort, professionalism, communication, and team support. Even small details can influence the perception of your practice. A well-organized and compassionate treatment experience strengthens trust. Stage 5 is follow-up and relationship. The journey does not end when treatment is complete. Follow-up communication and helps patients feel supported and valued. This stage may include post-treatment check-ins, educational resources, reminders for follow-up care. These interactions strengthen long-term relationships and increase referrals. Why mapping the journey matters. When practices map the patient journey, they often discover areas where patients may feel confused or uncertain. For example, unclear instructions before appointments, long waiting times, and lack of follow-up communication. Even small improvements in these areas can dramatically improve the patient experience. When the journey is smooth and supportive, patients feel confident recommending your practice to others. Your role is to guide them towards feeling of understanding, reassurance, and confidence. Practices that address both medical and emotional journeys create stronger patient relationships. The team's role. Every member of your team influences the patient journey. From the front desk to the clinical staff, each interaction shapes the patient experience. When your entire team understands the importance of the patient journey, they become active participants in creating a positive experience. This alignment strengthens trust and improves patient satisfaction. Key takeaway: the most successful practice don't just deliver medical treatment, they deliver a thoughtful, designed patient experience. By mapping the client journey and improving each stage, your practice can increase treatment acceptance, patient satisfaction, referrals. Internal marketing is not just about persuasion, it's about creating an experience where patients feel confident in choosing your practice. Action step: take a moment to reflect on your current patient journey. Write down each step a patient experiences from the first phone call to their final follow-up visit. Then ask yourself, where might patients feel uncertain or confused? How could we improve communication at each step? What small improvements could enhance the overall experience? Even minor improvements in the patient journey can significantly impact your practice growth.